Today we have a very special guest, Dr. Brian Pound, and we're going to be speaking about hypnosis. And I would like to start off by actually asking you a couple of questions about what hypnosis actually is. So, according to, well, yourself or other experts, what exactly is hypnosis?
Well, the answer to that question has been pretty elusive through the years. There have been many different theories. I don't believe anybody really knows what it is. Probably the most common theories are that it's a means of communicating with the unconscious mind in order to accomplish something that presumably can't be accomplished during the conscious state. That needs a lot of elaboration, and it's, as I say, it's just a theory. Through the years there have been many theories. Anton Mesmer, who's well known, thought that hypnosis was a form of animal magnetism, that there was some kind of interaction between humans and even between humans and inanimate objects. There have been many different forms of hypnosis, which I think indicate, again, that there have been many different theories of it. But for now, we really don't know.
Okay, and how does medical hypnosis, which is what you're involved with, for the most part, how does that differ from, say, stage hypnosis?
Well, in medical hypnosis, the objective is to create some sort of a change, presumably in relationship to a disease process. One is trying to heal, one is trying to correct an abnormality. One is actually performing a therapeutic approach to a patient with the idea that you're going to use the tool called hypnosis to create that change. In stage hypnosis, it's a form of entertainment where people are expected to do things like stand on one leg and cluck like a chicken, or in stage hypnosis or hypnosis performed by a non-professional, invariably it's an entertainment field, and it's one that I don't particularly approve of.
Okay, well, what types of conditions can be treated by medical hypnosis?
I can't think of any that I've been asked to treat that are not amenable to hypnosis. If one assumes that the interaction between the brain, the mind, and the body is what causes change in a person's health status, then if one can influence that particular chain through the immune system, which is also in connection with the nervous system, if one can influence that, then one can create change. And the way that that is done is by communicating with the unconscious, which I like to think of as the computer operator that operates the computer that I carry between my ears. So there really isn't any kind of condition that is not treatable this way.
Well, when you get a patient for the first time, what are some of the important things that you must know or that they must know to have a successful session?
I need to know what their expectations are. I need to know a bit about the problem that they're having and how that problem arose. In other words, I have to take a medical history. I need to know what things aggravate and what things may have a relieving effect on the condition. And I need to know whether the condition is really within the realms of reality to have that condition changed in some way. I get asked to treat many different conditions, and unfortunately there's the odd one that I just have to say I don't think that can be changed in the way that I approach medical treatment.
I understand. Well, that leads me to my next question, which is, can everyone be hypnotized, or can only some people succeed with it?
Well, I believe that everybody can be hypnotized. Whether they will go into a hypnotic state, a hypnotic trance, at a given time is the main question. Sometimes it takes a person a while to learn how to go into hypnosis, and so one would look at perhaps having to have several different sessions. Many people have the ability to go into a hypnotic trance very quickly. In fact, I've had situations where I've had to say to the person, please don't go into hypnosis yet. There's something more we need to do.
I see. And what about the people coming to you? Is there something that they need to do to prepare? Do they have to practice at home or something? Or what do they need to do if someone was going to come to you?
No, I don't think there's any preparation necessary. In fact, I don't think there's any preparation that a person can perform in order to prepare for the hypnotic session. I like to have one session where I get to understand the person's problem. I call it an orientation session. I like to describe to them what they're likely to experience, what I hope they'll experience, what I'm going to do, and what they're going to do. And I think in some ways that might be a good preparation. But in terms of things that they can do by themselves, no, I don't think there's anything that they could do that would make the session any easier.
I assume that different people take different times or amount of time to be able to have success with hypnosis. Could you tell us approximately how many sessions does it take for a person to succeed in hypnosis?
I'm a bit of a renegade on this, and I like to try a one-session change or one-session cure, if you want to call it that. I think that comes from the most popular thing that I get asked to do, and that is to help people quit smoking, and I try and do that in one session. People take lots of time, and other people take a very short period of time. My understanding is the record was for the amount of time taken to go into a hypnotic trance was with Milton H. Erickson, the father of modern hypnotherapy, who took 300 hours to enable a person to go into a deep enough hypnotic trance that he was then able to do some work with them. Most people will go into a hypnotic trance within an hour, sometimes two.
I understand. So if someone was considering hypnosis, what are the important factors that they need to think about if they're deciding that they're going to try hypnosis for a problem or for a situation they've got in their life?
I'm not sure that there's a straight answer to that. One of the questions that I like to ask at the beginning in the orientation session is, have you been to see a stage hypnotist? Because if they have, they will have a very definite viewpoint about what hypnosis may be. And so one of the things that's necessary is that I disillusion them about some of the myths that a stage hypnotist would try and have them believe. Obviously, a person who is seeking hypnosis, it would be useful to believe that that they have at least some belief in success, some expectation of success, the ability to cooperate. I have a difficult time with people who, and I don't think I'm alone in this, a difficulty in focusing their thoughts or concentrating or being able to follow simple instructions. But of course there are alternatives even then that one can use. But by and large, they need to expect some sort of a change. They need to believe that it's possible, and they need to actually have some kind of idea that they're going to cooperate.
Okay, and well, that brings us to the process of hypnosis itself. So, in your opinion, what is the most difficult part of the hypnotic process?